Are you struggling with lung sounds on the NCLEX? Don't worry, I've simplified everything for you. In this video, we'll go through 50 high-yield respiratory questions covering wheezes, crackles, stridor, Rhonchi, and more. Each question comes with the correct answer, clear rationale, and proven NCLEX strategies so you'll know exactly how to recognize lung sounds and choose the best answer on exam day. Stick with me to the end, you don't want to miss the bonus tips that could make all the difference in passing your NCLEX. Question 1. The nurse auscultates high-pitched musical sounds during expiration in a patient with asthma. What is this sound? A. Crackles. B. Stridor. C. Wheezes. D. Rhonchi. Answer: C. Wheezes. Rationale: wheezes are continuous, high-pitched musical sounds caused by narrowed small airways, e.g., asthma, COPD. Strategy: elaborated look for keywords, musical, high-pitched, expiration. That combo almost always equals wheezing. Eliminate crackles, popping sounds. Stridor, upper airway, Rhonchi, snoring. Question 2. A client with left-sided heart failure has fine crackles at the lung bases. What is the most appropriate initial nursing action? A. Encourage coughing. B. Place the client in high Fowler's position. C. Suction the airway. D. Withhold fluids. Answer: B. Place the client in high Fowler's position. Rationale: fine crackles equals fluid in alveoli, pulmonary edema. The first action is to improve ventilation with positioning. Strategy: when NCLEX says most appropriate initial, think, position, oxygen, or notify depending on urgency. Coughing and suction don't fix alveolar fluid. Withholding fluids needs an order. Question 3. The nurse hears inspiratory stridor in a postoperative thyroidectomy patient. What is the priority? A. Notify provider immediately. B. Administer nebulizer. C. Reassess in 30 minutes. D. Encourage coughing. Answer: A. Notify provider immediately. Rationale: stridor equals upper airway obstruction, laryngeal edema/hematoma. Can quickly progress to complete obstruction. Strategy: airway always takes precedence. On NCLEX, stridor is never ignored, pick the emergency intervention. Question 4. A COPD patient produces low-pitched snoring sounds that clear after coughing. What sound is this? A. Fine crackles. B. Rhonchi. C. Pleural friction rub. D. Wheezes. Answer: B. Rhonchi. Rationale: Rhonchi equals mucus in large airways clears with cough. Strategy: if the stem says clears after cough, that rules out crackles. Always watch for clues NCLEX gives you. Question 5. The nurse hears a grating, scratchy sound in a client with pleuritis. What is the interpretation? A. Crackles. B. Pleural friction rub. C. Rhonchi. D. Stridor. Answer: B. Pleural friction rub. Rationale: pleural rub equals inflamed pleural surfaces rubbing together. Strategy: words like grating or scratchy equals pleural rub. Eliminate crackles, fluid, Rhonchi, mucus, stridor, airway. Question 6. The nurse hears coarse crackles in a client with pneumonia. What's the best nursing action? A. Encourage incentive spirometer. B. Administer bronchodilator. C. Suction immediately. D. Restrict fluids. Answer: A. Encourage incentive spirometer. Rationale: coarse crackles equals alveoli filled with secretions/fluid. IS helps mobilize secretions. Strategy: NCLEX often tests airway versus alveoli. Suction equals large airways. Crackles equals alveoli use IS, deep breathing. Question 7. A client with emphysema has diminished breath sounds bilaterally. What does this indicate? A. Mucus obstruction. B. Hyperinflation of lungs. C. Normal aging. D. Pneumothorax. Answer: B. Hyperinflation of lungs. Rationale: in emphysema, alveoli are destroyed, lungs hyperinflate, sounds become quiet. Strategy: emphysema equals silent chest type presentation. Eliminate pneumonia and mucus, they cause extra sounds. Question 8. After a motor vehicle crash, a client has absent breath sounds on the right side. What's priority? A. Reposition to left side. B. Prepare for chest tube. C. Encourage deep breathing. D. Document findings. Answer: B. Prepare for chest tube. Rationale: absent sounds post-trauma equals pneumothorax/hemothorax. Strategy: in trauma, airway/breathing issues equals chest tube. Do not delay with documentation. Question 9. The nurse hears wheezing that worsens after nebulizer treatment. What's the next step? A. Document findings. B. Call provider immediately. C. Reassess in 30 minutes. D. Encourage cough. Answer: B. Call provider immediately. Rationale: worsening wheeze equals status asthmaticus, life-threatening. Strategy: if condition worsens after treatment, it's a red flag. Escalate care. Question 10. A client reports sudden sharp chest pain with breathing. Nurse hears pleural friction rub. Which condition is most likely? A. Pneumonia. B. Pleural effusion. C. Pleuritis. D. COPD. Answer: C. Pleuritis. Rationale: rub equals pleural inflammation. Strategy: chest pain plus rub equals pleuritis. Don't confuse with crackles and pneumonia. Question 11. The nurse hears fine crackles at the end of inspiration in a postoperative patient. Which condition is most likely? A. Asthma. B. Atelectasis. C. COPD. D. Bronchitis. Answer: B. Atelectasis. Rationale: fine crackles at inspiration often indicate alveoli reopening after collapse, common in atelectasis. Strategy: on NCLEX, fine late inspiratory crackles equals atelectasis or heart failure. Match post-op clue atelectasis. Question 12. The nurse hears loud bronchial sounds over the lower lung fields. What does this indicate? A. Normal breath sounds. B. Lung consolidation, pneumonia. C. Asthma exacerbation. D. COPD. Answer: B. Lung consolidation, pneumonia. Rationale: bronchial sounds belong over trachea. Hearing them in lung periphery equals consolidation. Strategy: key test trick breath sound in wrong location equals pathology. Question 13. A child with epiglottitis presents with inspiratory stridor and drooling. What's the nurse's priority? A. Prepare for intubation. B. Encourage fluids. C. Monitor for 30 minutes. D. Administer antibiotics first. Answer: A. Prepare for intubation. Rationale: stridor plus drooling equals airway emergency. Secure airway immediately. Strategy: airway always outranks circulation or meds. NCLEX drooling plus stridor equals intubation. Question 14. The nurse hears medium crackles in the right lower lung of a patient with edema. Which condition is most consistent? A. Heart failure. B. COPD. C. Asthma. D. TB. Answer: A. Heart failure. Rationale: crackles signal alveolar fluid hallmark of left-sided HF. Strategy: crackles plus HF history equals pulmonary edema. Eliminate obstructive lung diseases. Question 15. A patient with pneumonia suddenly develops absent breath sounds on the right side. What's the nurse's next step? A. Continue monitoring. B. Suspect pleural effusion or pneumothorax. C. Encourage coughing. D. Increase fluids. Answer: B. Suspect pleural effusion or pneumothorax. Rationale: sudden absent sound equals collapse or fluid. Requires immediate evaluation. Strategy: when NCLEX says sudden absent, always suspect a serious complication. Question 16. The nurse hears a low-pitched rumbling sound that improves after coughing. What sound is this? A. Rhonchi. B. Crackles. C. Wheeze. D. Stridor. Answer: A. Rhonchi. Rationale: Rhonchi equals mucus in large bronchi, clears with cough. Strategy: keyword clears with cough. Immediately select Rhonchi. Question 17. Which sound is most common in bronchitis? A. Rhonchi. B. Wheezes. C. Stridor. D. Crackles. Answer: A. Rhonchi. Rationale: bronchitis equals mucus plugging Rhonchi. Strategy: think bronchi Rhonchi. Easy NCLEX association. Question 18. A patient has expiratory wheezes in all lung fields. Which diagnosis fits best? A. Pleural effusion. B. Pneumothorax. C. Asthma exacerbation. D. Pulmonary embolism. Answer: C. Asthma exacerbation. Rationale: wheeze equals narrowed small airways, hallmark of asthma. Strategy: expiratory wheeze equals asthma. Inspiratory stridor equals obstruction. Question 19. A patient develops fine crackles after rapid for fluids. What condition is suspected? A. Pulmonary edema. B. Atelectasis. C. COPD. D. Pneumothorax. Answer: A. Pulmonary edema. Rationale: rapid infusion overloads lungs, fluid crackles. Strategy: NCLEX loves fluid overload equals crackles. Question 20. The nurse hears pleural friction rub in a pneumonia client. Which treatment is expected? A. Antibiotics. B. Anti-inflammatory. C. Diuretics. D. Bronchodilators. Answer: B. Anti-inflammatory. Rationale: rub equals inflammation of pleura treated with anti-inflammatory meds. Strategy: rub equals inflammation, not infection, not antibiotics first. Question 21. The nurse hears fine crackles and basses of a post-op patient. Best initial action? A. Incentive spirometer. B. Diuretic. C. Notify provider. D. Supine position. Answer: A. Incentive spirometer. Rationale: post-op crackles equals atelectasis. IS re-expands alveoli. Strategy: always think post-op crackles equals atelectasis IS. Question 22. Inspiratory wheezes in a COPD client are due to A. Secretions in airway. B. Narrowed bronchioles. C. Fluid in alveoli. D. Pleural inflammation. Answer: B. Narrowed bronchioles. Rationale: wheezing equals narrowed bronchioles from bronchospasm. Strategy: eliminate crackles/fluid choices, those relate to alveoli. Question 23. Which sound requires immediate intervention? A. Crackles in pneumonia. B. Rhonchi in bronchitis. C. Diminished breath sounds in COPD. D. Stridor in child with croup. Answer: D. Stridor in child with croup. Rationale: stridor equals severe upper airway obstruction. Strategy: always pick stridor as emergent. Question 24. The nurse hears coarse crackles that don't clear with coughing. This is most likely A. Pulmonary edema. B. Bronchitis. C. Asthma. D. Pleural effusion. Answer: A. Pulmonary edema. Rationale: crackles from alveolar fluid not affected by cough. Strategy: if it doesn't clear with cough equals crackles, not Rhonchi. Question 25. Chest tube patient has absent breath sounds on left side. Suspect: A. Tube dislodgement/obstruction. B. Pneumonia. C. COPD. D. Asthma. Answer: A. Tube dislodgement/obstruction. Rationale: absent breath sounds equals lung recollapsed. Strategy: check equipment whenever sudden absent sound plus device present. Question 26. A pleural rub means A. Narrowed airway. B. Pleural inflammation. C. Fluid overload. D. Bronchospasm. Answer, B. Pleural inflammation. Rationale, rub equals inflamed pleura rubbing. Strategy, keyword rub always equals pleura. Question 27. Which sound is most common in bronchiectasis? A. Wheezes. B. Crackles. C. Stridor. D. Pleural rub. Answer, B. Crackles. Rationale, chronic dilation mucus pooling crackles. Strategy, chronic mucus retention crackles. Question 28. Asthma patient suddenly has silent chest. What's priority? A. Give another nebulizer. B. Notify provider stat. C. Encourage cough. D. Increase 4 fluids. Answer, B. Notify provider stat. Rationale, silent chest equals total airway obstruction impending failure. Strategy, no wheeze equals worst case in asthma. Question 29. Which sound is bubbling/popping during inspiration? A. Crackles. B. Rhonchi. C. Wheeze. D. Stridor. Answer, A. Crackles. Rationale, crackles sound like popping due to alveolar fluid. Strategy, crackles equals popping popcorn. Question 30. The nurse hears Rhonchi. What should be done first? A. Encourage cough. B. Increase oxygen. C. Call provider. D. Give epinephrine. Answer, A. Encourage cough. Rationale, Rhonchi may clear with cough. Strategy, always try least invasive first. Question 31. Bronchial sounds in peripheral lung fields indicate. A. Atelectasis. B. Pleural effusion. C. Pneumonia consolidation. D. COPD. Answer, C. Pneumonia consolidation. Rationale, consolidation transmits bronchial sounds. Strategy, bronchial in periphery equals pneumonia. Question 32. Pulmonary embolism lung sounds are often. A. Clear. B. Crackles. C. Rhonchi. D. Wheezing. Answer, A. Clear. Rationale, PE affects perfusion, not ventilation. Strategy, trick Q lungs may be clear in PE. Question 33. Which sound is musical and squeaky? A. Wheeze. B. Crackle. C. Rub. D. Rhonchi. Answer, A. Wheeze. Rationale, wheeze equals squeaky sound from narrowed airways. Strategy, musical equals wheeze. Question 34. Early inspiratory crackles are common in A. Asthma. B. Chronic bronchitis. C. Pneumothorax. D. COPD. Answer, B. Chronic bronchitis. Rationale, early crackles often equals chronic bronchitis. Strategy, early crackles equals bronchitis, late crackles equals HF/atelectasis. Question 35. A rub that persists during breath-holding indicates. A. Pericardial friction rub. B. Pulmonary edema. C. Asthma. D. COPD. Answer, A. Pericardial friction rub. Rationale, pleural rub disappears with breath hold. If sound remains pericardium. Strategy, NCLEX trick, breath hold test. Question 36. ARDS most often presents with A. Diffuse crackles. B. Wheezing. C. Stridor. D. Rhonchi. Answer, A. Diffuse crackles. Rationale, ARDS equals widespread fluid collapse crackles everywhere. Strategy, ARDS equals diffuse crackles plus hypoxemia not improving with O2. Question 37. Dullness to percussion plus absent breath sounds indicates. A. Pneumothorax. B. Pleural effusion. C. COPD. D. Asthma. Answer, B. Pleural effusion. Rationale, fluid equals dullness plus absent breath sounds. Strategy, dull equals fluid, hyperresonance equals air. Question 38. Which sound is typical of chronic heart failure? A. Fine crackles. B. Wheezes. C. Rhonchi. D. Stridor. Answer, A. Fine crackles. Rationale, pulmonary edema from HF crackles at bases. Strategy, CHF clue equals always crackles. Question 39. Asthma patient with expiratory wheezes is prescribed. A. Bronchodilator. B. Diuretic. C. Antibiotic. D. Steroid only. Answer, A. Bronchodilator. Rationale, bronchodilator relieves spasm causing wheeze. Strategy, wheeze equals give bronchodilator. Question 40. Which sound is like grating leather? A. Pleural rub. B. Rhonchi. C. Wheeze. D. Crackle. Answer, A. Pleural rub. Rationale, inflammation leather grating noise. Strategy, NCLEX phrase grating equals pleural rub. Question 41. Which sound equals partial airway obstruction? A. Stridor. B. Wheeze. C. Crackle. D. Rub. Answer, B. Wheeze. Rationale, wheeze equals narrowed airway, partial block. Strategy, don't confuse with stridor, complete obstruction risk. Question 42. Snoring-like sounds indicate. A. Secretions in bronchi. B. Alveoli popping open. C. Narrow bronchioles. D. Inflamed pleura. Answer, A. Secretions in bronchi. Rationale, snoring equals Rhonchi. Strategy, if they give you snoring, it's Rhonchi. Question 43. Most common sound in emphysema? A. Diminished breath sounds. B. Stridor. C. Wheezes. D. Crackles. Answer, A. Diminished breath sounds. Rationale, hyperinflated lungs equals quiet sounds. Strategy, emphysema equals quiet chest. Question 44. Elderly patient has fine morning crackles that disappear after deep breathing. Likely cause? A. Normal age-related atelectasis. B. Heart failure. C. Asthma. D. Bronchitis. Answer, A. Normal age-related atelectasis. Rationale, small alveoli collapse at night reopen after breathing. Strategy, elderly plus clears with activity equals normal. Question 45. Bronchial sounds in lung periphery suggest. A. Consolidation. B. Airway collapse. C. Fluid overload. D. COPD. Answer, A. Consolidation. Rationale, pneumonia consolidation transmits bronchial sounds. Strategy, bronchial in periphery equals pneumonia. Question 46. Which sound equals upper airway narrowing? A. Wheeze. B. Stridor. C. Crackle. D. Rhonchi. Answer, B. Stridor. Rationale, stridor equals high-pitched inspiratory noise from upper airway. Strategy, always emergent on NCLEX. Question 47. Acute bronchitis usually produces. A. Rhonchi. B. Crackles. C. Stridor. D. Diminished sounds. Answer, A. Rhonchi. Rationale, secretions in bronchi equals Rhonchi. Strategy, bronchitis equals Rhonchi. Question 48. Late inspiratory crackles are common in. A. Heart failure. B. Asthma. C. COPD. D. Bronchitis. Answer, A. Heart failure. Rationale, pulmonary edema produces late crackles. Strategy, late crackles equals HF. Early equals bronchitis. Question 49. After central line insertion, patient has absent breath sounds on right side. Suspect. A. Pneumothorax. B. Pleural effusion. C. COPD. D. Asthma. Answer, A. Pneumothorax. Rationale, accidental puncture lung collapse. Strategy, NCLEX loves central line absent breath sound equals pneumothorax. Question 50. Asthma patient's wheezing suddenly disappears. What does this mean? A. Condition improving. B. Complete airway obstruction. C. Normal finding. D. Pneumonia. Answer, B. Complete airway obstruction. Rationale. Silent chest in asthma equals life-threatening. Strategy, disappearing wheeze equals worst sign. Always pick emergency action. Great job making it through all 50 respiratory questions. By now, you should feel more confident identifying lung sounds and knowing how the NCLEX will test them. If you found this helpful, make sure to like, subscribe, and share with your fellow nursing students. It could be the key to their success too. And don't forget to check out my other NCLEX made simple videos for more exam-focused practice. Keep practicing, stay confident, and remember, you've got this. See you in the next video.